So my background is I started in general practice and I did general practice for a long time, probably 15 or 16 years. But while I was doing general practice, I developed an interest in skin and skin conditions because it's such a large component of what you see as a GP, rashes and so forth. I did some introductory skin cancer medicine training with HealthCert. I think that was in 2006. And then I started doing some skin checks and skin cancer management in my own general practice. At the same time, I went and did some training in anti-wrinkle injections because that was really the only injectable that was available at the time, and I incorporated both of those into my general practice. But what I found was that because general practice is very hectic and very busy, it's hard to fit those things in around normal consultations. You really need to allow dedicated time to do it. So I did a dedicated session of injectable treatments, and then I tried to have a dedicated time to do skin checks and to do excisions. It depends, I think, on the nature of the practice that you work in and how busy it is, but that didn't work very well for me. Only because I was in a very busy practice, and we also had a lot of injuries and a lot of quite acute medicine presenting, chest pain and asthma and things like that. And it's very difficult to, if you've got to rush off and see somebody in the treatment room and abandon your skin check or whatever. So I just found, from my point of view, it was easier to actually, outside of my general practice, go and work in a dedicated skin cancer setting. So that was the thing I did to start with. It becomes very apparent very quickly when you're working in a skin cancer clinic how often patients are presenting with cosmetic skin concerns. Yes, I know my freckles are safe, I know that brown spot isn't a skin cancer, but how can I get rid of it? So you're having a lot of discussions with patients about how to manage those very common issues. I also wanted to do a little bit more aesthetic medicine. So again, I went and worked in a dedicated aesthetic medicine clinic and, increased the amount of experience I had, and also increased my exposure to doctors who are more experienced in aesthetic medicine than I was at the time, and also to more devices and more treatments that were available for patients. And what I did was I slowly cut back the amount of general practice that I was doing and increased the amount of skin cancer medicine and aesthetic medicine that I was doing. And I eventually left general practice completely and just focused on those two areas. I predominantly do aesthetic medicine now. So I work in a clinic where we have a number of doctors, we have a nurse, we have some dermal therapists, we do a lot of injectables, but we also do every other sort of treatment that's available. We've got a lot of devices to treat various skin concerns. It's very satisfying work.